Hi, I'm Dr. Johnson with Karmanos Cancer Institute at McLaren Port Huron. I'm a radiation oncologist, and a big part of my practice is treating patients with lung cancer. Unfortunately, lung cancer is one of the largest causes of all cancer deaths in the United States. Part of the reason for this is because when patients are diagnosed with lung cancer, about 40% of them are found to have stage 4 disease at the time of their diagnosis, which means that the cancer has already spread to other parts of their body and is likely to not be curable. One way we can improve on those numbers is by having patients undergo screening exams to try and detect the cancer at an earlier stage. Cancer screening is very common for other types of cancer, such as mammograms for breast cancer, blood work with PSA screening for prostate cancer, and colonoscopy to screen for colorectal cancers. Up until recently, we really did not have a good tool for screening for lung cancers. But in the past 10 years, there's been the development of low-dose CT scanning. This is technology that's very similar to undergoing a standard CAT scan, except that it uses 90% less radiation, making the test very safe overall. To undergo this type of exam, it's very similar to a standard CAT scan, where patients will lay on a table. The table moves them through a circular opening, and there's no contrast given in the veins, and the time of the exam is relatively short. Not everyone qualifies for this type of screening exam. Patients should be considered at a higher risk of developing lung cancer, and based on our current standards, that means patients have had at least a 20-pack-year smoking history, which means they've smoked approximately 1 pack of cigarettes a day for 20 years. Patients similarly who have a half-pack-a-day smoking history for 40 years should qualify, as well as patients who smoke 2 packs a day for 10 years. So if you fit the prior criteria but have quit within the last 15 years, you also should be eligible. And if you're unclear if you might qualify, you can certainly talk to your primary care physician or call one of our resource numbers provided after this ad. As a radiation oncologist, I can tell you that when cancer is found at an earlier stage, it is usually easier to treat, oftentimes with surgery or as little as 1 week of radiation with much higher cure rates. So I think that this is a valuable technology, and I do think it's a little bit underutilized because it's newer. Please feel free to call us if you have any questions or you think you might qualify.